All right, that was a fantastic session of panelists, and I'm really excited to have everybody join us for the Q&A now. Really, there's a lot we could talk about there, and I have a lot of interest in this around vaccine hesitancy, I think, in particular. Erica, I really loved your glass is so full. It's not even half full. It is full, and so that's a great perspective, and I appreciate you really throwing yourself into our baseball theme. All right. I just, one thing I wanted to finish up with, Dr. Tracy, is that you mentioned making HPV a strategic priority. How did you do that? How did you get the buy-in from the leadership to make that a strategic priority?
Well, we've looked at vaccines, and I think when they understood the impact of cancer in our community and that we are fighting such an uphill battle in Kentucky, anything that we can do to improve that. And we've had a lot of champions within our pediatric groups, and they really have asked us to step that up.
Oh, I was muted. Fantastic. So key, having champions and people who really understand the impact. I think one thing that I learned a little bit from your talk is that the importance of keep going forward even when there are some setbacks. It sounds like there wasn't great turnout from one of the drive-throughs. So how do you keep pushing forward? How do you maintain the momentum?
Yeah, I think we keep looking at what is successful. And our community health, we realize that we're kind of fighting in the primary care world with other folks trying to edge into the market as far as the pharmacies and Amazons and those kinds of things of the world, and we feel like we can offer that quality care. So we have to figure out better ways to bring care to the patients where they want it, when they want it, and how they need it. So that's part of what's motivated us, and that's why we're in the schools now. We're doing acute care there to try to help kids stay in school, help parents. And we're looking at different ways that we can continue to bring healthcare to the patients instead of always having to bring the patients to us.
Fantastic. And last question about the drive-through. Somebody once asked is, do you find providers were typically on board with the model for drive-through vaccines?
They were, because it really helped their staff, because the offices are pretty overwhelmed. And when these folks go to the drive-through, that's less folks coming through, taking up time, getting vaccinated with the nurses. We would put them on nurses' schedule. So the nurses are more freed up to help in the offices. So that's been very beneficial.
Fantastic. Thank you. I want to sort of transfer this idea of momentum to you, Dr. Hodez and Erica. How do you maintain momentum in the face of the vaccine hesitancy?
Yeah, I mean, it's a huge issue, right? Because now all of the empowerment that we've seen by anti-vaccine activists during this time of COVID-19, they now have political backing, they have money, they have organization, and eventually COVID will start to dissipate. And as that happens, it's not like they're going to say, okay, we're done, we're going to fold the tent. They're going to use that newly empowered status and political clout and political connections to go after other vaccines. And I'm fearful especially about the HPV vaccine, because they were, prior to COVID-19, that had become a major target, and they were claiming it causes infertility and autoimmunity and all this other nonsense. And so how we start walking this back is very tough, because now it's more than anything else, it's a political movement, especially in parts of the country, such as where I am in Texas and in the southern states. I mean, the vaccination rates are far lower than most of the country, and HPV vaccination rates are really low. So how we get this back, it's almost gone beyond the health sector. And so that's a long way of saying, I'm not sure I know what to do anymore. I mean, certainly you can, organizations like Vaccinate Your Family do a great job providing timely and reliable vaccine information. And that's certainly a help. And then you have the Surgeon General, U.S. Surgeon General Vivek Murthy, sounded the alarm about the social media companies and switching up computer algorithms, and that's important as well, but it doesn't really get to those generating the content. So what could be the big thing that could be done to overcome that? I'm not sure I have the answer. What's happened in Australia is kind of interesting. They've announced a campaign to eliminate cervical cancer. I know the HPV vaccine targets other cancers as well, but they've specifically announced a campaign to eliminate cervical cancer by the year 2030, I think it is, or 2031, and I kind of like that. I like the big, audacious goal, and if we could get, especially our elected leaders, behind that concept of eliminating cervical cancer, and really roll it out like a campaign similar to the March of Dimes, which was done for polio. Maybe maybe we try that on a regional basis first to see if that's making any impact, because I worry the default is now the empowered anti-vaccine activists that have been targeting COVID-19. We're going to start seeing spillover to all other vaccinations. Certainly here in Texas, we're getting ready for the next legislative session next year, and we're hearing about potentially a lot of bills being filed, supported by anti-vaccine activist groups that are looking pretty ugly. So I worry about this getting much worse. So to counter it, maybe we need to do some big, bold, and audacious things.
So I would actually argue there is a path forward. As you all saw in my presentation, I am incredibly optimistic because you got no other option right now, right? We got to be optimistic. We got to think that there's a path forward. Also, side note, my husband was so thrilled when I said that I was presenting with Dr. Peter Hotez, so just FYI. And he also gave me all my baseball analogies, so shout out to my husband for that. But what we think at Vaccinate Your Family is that vaccine hesitancy, mis and disinformation is, as our board member, Dr. Claire Wardle says, not a social media problem, but a human problem, right? As long as humans have existed, we like to spread that scary story we heard from our cousin or our neighbor. And so the solution to that is actually community-based work. What we saw work during COVID-19 was going to community-based organizations, going to leaders and saying, what do you need? What are you hearing? How can we help, right? And trusting them to take the message the way they felt was most appropriate, word it how they want it, package it how they want it, but really make it their own because they know their community best. Is this easy work? No. I wish it was so simple as to say to Facebook, change your algorithm and everything would magically go away, right? But this is hard work that's going to take many, many, many years, going community by community, right? It's like Healthier Generation says, we can only move at the speed of trust. But I'm encouraged through some of the partnerships we've formed. So for example, through Good Health Wins with NCNW, the National Council of Negro Women, as well as the Pan-Hellenic Council. They have 4.5 million members between all of them. And I'm not saying it's all of them, but you will notice we have started to close that gap on racial disparities between the African American and white communities. And I think it's because of groups like Good Health Wins taking the time, finding those trusted leaders and asking them, how do you want to do this?
Yeah, I mean, I think there's definitely merit in that, and the proof of concept of it is what we saw with COVID vaccination rates in Black and Brown communities. So if you looked at, if you go back to November, December 2020, and if you looked at, the polls conducted by the Kaiser Family Foundation and others, you saw that the most vaccine hesitant groups were Black and Brown communities and a group that was labeled white Republicans as opposed to white Democrats. And there was a lot of work that went in, especially in the African American community, Hispanic community, and the vaccination coverage rates. The polls and the survey showed that vaccine hesitancy had decreased quite a bit. So especially in Black and Brown communities, but the groups that were tying themselves to a political movement, not so much. And that's where we saw the massive deaths coming in that Delta wave in 2021 of very much along a partisan divide. But, you can look at that as the glass half empty or half full. And the half full part is, there was some impact on working as Erica says, with community outreach, and the Rockefeller Foundation Vaccine Equity Group, and I was part of that. Also put a lot of effort in, and so things are not etched in stone if you're prepared to put a lot of work in. I went on, and then I started going, for instance, on a number of podcasts and Zoom calls that reached Black and Brown audiences and our local HBCU community radio station, and a lot with some of the local churches. And I never forget, I did one with Dr. Eric Freeman, who's a pediatrician in the Richmond, Virginia area, and he asked me to join his church Zoom, and we did, and his pastor was on, and it's one of his real historic African American churches in Richmond, Virginia. And I just asked the pastor point blank, "Do you think things are getting better?" And he said yes. And I said, "Well, what do you think that is?" And his answer was quite interesting. He said, "Well, part of it is docs like you speaking out," but he offered that the informal network of clergy that had formed in Black churches made a huge difference. And I think he was onto something. I think that did have an impact. So, I think appealing to core values of communities, as Erica correctly points out, listening to what communities want, no question, I think that's part of this answer. The thing I'm still worried about is the part that's dug in because of political allegiance, and that one I'm still very much stuck on.
Thank you, everybody. I could stay in the Zoom room with all of you for the rest of the day, and maybe we would eventually come up with another solution. But I appreciate this talk and the context that you've all given to HPV vaccination in the realm of COVID, and appreciate all of the work that you're doing to increase vaccine confidence for all vaccines across the country and the world. So thank you again. Thanks for all the work you're doing. To everybody else who's going to join us for the next session, you'll go back into your homepage and join us for session 8. We've got a 7th inning stretch. Everybody needs to take a stretch, even the best players. So we'll do that, practice our high walking knee lunges, and then think about sort of the big takeaways as we roll into the next session. Thanks so much, everybody.